Good evening, my dear students and friends. Myself, Dr. Ravi Kant Pathak, and I'm going to start your video lecture class. In the last video lecture, we have discussed about the absorption of the digested products. And now in this video lecture, we will talk about the last portion, that means last topic of this chapter, disorder of the digestive system, protein, energy, malnutrition, and calorific value of the food. So if you'll see, so how many types of the disorder they are related to the digestive system. So here 4 to 5 different disorder. First one is the jaundice, second is the vomiting, third is the diarrhea, fourth one is the constipation, and last is the indigestion. So in the sequence of this disorder, so we are going to start first, that is the jaundice. And you know jaundice, it is the when bilirubin concentration inside the liver, because you know when the RBC cell died, it will release the heme protein. This heme protein, there is the catabolic degradation takes place. After that, it will form the bilirubin, and bilirubin will ultimate converted into the biliverdin. When bilirubin will not converted into the biliverdin, so their concentration much increases, and this cause the hyperbilirubinemia. And when hyperbilirubinemia causes, so this is a resultant, it means ultimately it causes the jaundice. So how, what is, which organ affected? So here you can say liver is affected, skin and eyes. It turns yellow due to the deposit of the bile pigment. So you know very well, because bile pigments is responsible for the formation of bilirubin and biliverdin. Okay. Next one that means here they have been the vomiting. Vomiting, you know very well, it is the ejection of stomach contents through the mouth, and this is the reflex action. You know very well, during the esophagus, that is, you can say food pipe. These food pipe, they are made up of the smooth muscles, and smooth muscles responsible for the peristaltic movement. And peristaltic movement means the movement of the food downwards into the stomach through the peristalsis movement of this, that means muscular movement of this esophagus. Okay, so this is called the, you can say it is called the peristalsis. And sometimes this peristalsis may be reverse. So here you can say, that means when reverse peristalsis takes place, so that is reflex action. This is the reflex action, means you can say involuntary. This is the reflex action controlled by the vomit center in the medulla. So you know medulla, it controls the involuntary action. And a feeling of the nausea precedes vomiting. So that means you can say nausea is the primitive stage. That means primitive means that means simply you can say this is the first stage of the vomiting. This is the first stage of vomiting. Okay. Now if we'll see, so what is the vomiting? Simply when the reverse peristalsis occurs in case of the esophagus, then it will cause the vomiting. Okay, and this vomiting has generally ejection of the stomach contents, because you know when it passes into the stomach, so these stomach contents release outside through the vomiting phenomenon. Next disease they have given the diarrhea. So what is the diarrhea? The abnormal frequency of bowel movements, okay, and increase the liquidity of the fecal discharge. Means you know very well. So diarrhea, that means large intestine, it absorbs the water as well as removes the fecal matter. So during what happened? During the diarrhea, so it may be bacterial, viral, or other infections. Okay, so the abnormal frequency of the bowel movements and increased liquidity of the fecal discharge, means from the fecal matter, so water cannot be properly absorbed. Okay, and there is the much loss of water through the fecal matter, and it reduces the absorption of the food. Okay, so how it cause? It is cause the absorption of the food proper not takes place. Okay, and you know absorption of the food where it takes place, it absorbed by the mucosa. Okay, mucosa, that is the internal lining layer of the alimentary canal. Next disease, that is the constipation. This is the you can say lifestyle disease, because it depends on your habit. Okay, food habit, food diet. Okay, in constipation the fecal matter are retained within the rectum as the bowel movements occur irregularly. When your bowel movements it become irregularly, okay, so that time it will cause this disease. Okay, so when the bowel movements become irregularly, and where food, that means where fecal matter retain, it retain inside the rectum. And why retain? Because there is the irregular movements of bowel, okay, irregular movements of the bowel, and this fecal matter retain inside the rectum, and it cannot be comes outside, means no, not proper egestion takes place. So this is called the constipation. Last one they have given about the digestion. So indigestion. Indigestion means you can say in this condition the food is not properly digested, leading to a feeling of fullness. You can say if you have went anywhere, any party or any wedding party, anywhere, you had much food, okay, so that means there is not proper digestion takes place, and every time you will feel like stomach is the full, okay, this is called indigestion. And what is the factor? What is the factor which cause the indigestion? So they have given the inadequate enzyme secretion. So maybe stomach or duodenum, so that means not secretes the proper enzyme. So this cause the indigestion. And anxiety, food poisoning, overeating, and spicy food. If you are having a spicy food or overeating, because you know very well when you are attending the party, so you are getting the food, so you are getting the food from your what your you behaves as a guest, and people's other people's they will be as host, okay, so that time what you will do, you will take much food, you will try to take much food, and when you will take much food, that this type of the indigestion condition will come. Next, second topic, that is the second topic is named as the PEM. So PEM stands for protein energy malnutrition. And this type of the disease found in those countries which is the very poor in condition, like you know South Africa, which is also known as the blind continent. Okay, so there is the very people. It is the very people. That means you can say simply this is the very people country, people very poor country. Clear? This means you can say very poor country. This is why, because this due to this they also have given the name. Uh, they also have given the name blind continents. Okay. So now if we'll see what it have given. So PM, protein energy malnutrition. This is under consumption of the calories or protein. It means if you are having the food, if you are having the food and this food is not proper content like proper protein, food, fat, carbohydrate, they have very less content of the protein. So this is called the protein allergy malnutrition. Most important form of malnutrition, so there is the two different form of, this is the most important means, so this means you can say this protein allergy malnutrition is the most important form of malnutrition, okay. And this associated with the poverty, I had already told when I have started. So associated with the poverty, and what is this means, you will not get the enough food, not enough food, and poor quality of food. So and the people's here in most of the people's I also seen, they use the food for just for flavor enhancing agents, like you know MSG, ammonium sodium glutamate. So monosodium glutamate, which is also known as the Azinomoto, they are using for the food enhancer for flavoring. If they mix with the food, so their flavor increases, and people's they eat very means you can say very good way, because flavor enhances, so they like much, okay. And this MSG caused the very big disease which is known as the Chinese restaurant syndrome, CRS, and in which backbone become bent, okay. And you know, so one times Maggie also banned due to this Ajinomoto they have mixed in the Maggie noodles, okay. So one time government banned, but now it is going on, okay. So means peoples they are eating the, now they are eating the few food without quality, means not content of the protein, not content of the fat, not proper content of the carbohydrate. So they just eating, they are just eating. So you should to focus on that, means content of the carbohydrate, fat, protein, so everything you should to decide. So there is the two different disease generally found due to the protein deficiency. First is called the Kwashiorkor. extreme protein deficiency. This Kwashiorkor is basically related to the protein deficiency, and another is the marasmus. It is the extreme calorific deficiency, means you can say both, that is the protein as well as calorific deficiency. So that means you can say fat deficiency, carbohydrate deficiency. This is the marasmus. Okay, so here people, you can say this is child suffer from the Kwashiorkor, and if you see, so their belly comes outside. Okay, so this child generally suffer from the Kwashiorkor. Okay, now we will see the difference between Kwashiorkor and marasmus disease. Okay, so here you can say in case of the Kwashiorkor occurs due to the deficiency of protein in diet. We have already told. So Kwashiorkor basically they are related with the when the much protein deficiency takes place in their diet, that is called Kwashiorkor. And in case of the marasmus, there is the protein deficiency of protein, simultaneously carbohydrate deficiency as well as fat. These components also deficiency, that means protein deficiency, and calorific value means carbohydrate as well as fat. So this is called the marasmus. Child shows edema, that means what is the edema means you can say excessive watery fluid collecting in the tissue of body. Simply you can say excessive watery fluid collecting in the tissue of body, it is known as the edema. Okay, so edema where happened? It happened in the lower legs, lower arms, and usually in the face. And here no swelling. We already seen in case of the Kwashiorkor, so there is the belly sometimes they comes outside. So that means edema means you can say excessive watery fluid collecting in the tissue of body, that is called edema. Next, if you see the Kwashiorkor appetite is poor. Here appetite is poor, clear, and skin show no change. Here in skin there is no change. Here appetite is usually good. It means that marasmus child, they become hunger. Okay, and skin is flasky and diffuse pigmentation means proper pigmentation, that means not takes place. Okay, here irritable. Some Kwashiorkor patient, they show the phenomenon of irritable. Next is the moaning. So moaning means you can say sexual pleasure, so they also show the sexual pleasure. And apathetic means you can say no interest, that is neutral type. So means Kwashiorkor patient, they show the sexual pleasure, and apathetic means little bit interested, that is no interest, and irritate, every time irritate. Here quiet and apathetic. Quiet means that is you can say silent mode, and apathetic means little bit neutral. Okay, next if you'll see the next point, so next what it have again, it occurs, this is the very important difference between the Kwashiorkor and marasmus. So it occurs in the children from 1 to 5 years of the age. Okay, it means Kwashiorkor were found. So Kwashiorkor found in case of the children. Okay, it is found in case of the children, and how many years? It may be from 1 to 5 years. So you can say the child should be 1 to 5 years of the age. This is generally suffer. So this is the in case of Kwashiorkor. So here you can say in case of the marasmus, it occurs in infants up to 1 year of age. Okay, in case of the marasmus occurs in infants up to 1 year age, because it can be take place very, that means infants are early born baby up to 1 year age. So this is generally found in case of the marasmus. Okay, so now we have seen the difference between Kwashiorkor and marasmus disease. And next and last topic of this chapter, calorific value. We know very well, and one time they have already asked in the NEET exam. So one people, he went into the restaurant, and he ate 100 gram fat, 100 gram carbohydrate, 100 gram protein. So what they will get the energy? What he will get energy? So such type of question asked. So calorific value means you can say it is the amount. If you see what I have again, it is the amount of energy produced on complete combustion of 1 gram of food substance in the calorimetry in a laboratory. Okay, so calorimeters. Okay, in the calorimeters in a laboratory, that is called the calorific value. And calorific value of the carbohydrate, protein and fat. So fat have the maximum, fat have the 9.45 kilocalorie per gram. Fat is the carbohydrate is the 4.1 kilocalorie gram, and protein have the 5.65 kilocalorie per gram. If we'll check, so which have the maximum? So maximum found in case of the fat. Okay, and if you'll see, so it is more than physiological value. So that means this calorific value always more than physiological value. Okay. Next, most abundant, if you see, so what it's saying, most abundant components of cell, tissue, organism, water, we know very well in our body. So 70% weight of the body have the water. So 60 to 75% in human body. And then protein 9%. So maximum amongst organic compounds in our body. So maximum amongst organic compounds in our body. So that you can say protein and then carbohydrate. Okay, so now we will see here, that means the value of calorific value we will see here. Okay, so macronutrient, if you will see macronutrients and approximate calorific value per gram. So here in this figure, in this flow, that means table, you can easily understand. So which have the maximum value, 9 kilocalories. So 9 kilocalorie value generally found in case of the fat. So that means much highest value, highest calorific value found in the fat, then protein 4 point something, and then carbohydrate 4. And alcohol, that is the 7 kilocalorie, that is also provide the much you can say they provide the here you can say it provide the much calorie, much energy. Okay, much calorific value of the alcohol. And you know very well, so now this is the corona times, the government they have opened they have closed everything but wine shop open, because he know very well. So alcohol they provide a much calorie. They provide much calorie, due to this government they have planned to open the wine shop. Okay, so now we will see that